Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Haidar Al-Hakim, the Third Eye Doctor. Pull up a chair and get ready for some candid and uncompromising discussion with experts, innovators, agitators, and influential people from every corner of health and well-being. From inside the hospital to at home in the kitchen, we're leaving no stone unturned in our quest to uncover the secrets of healthier, happier, more successful, and less stressful lives. Thank you so much for joining us, and without further ado, let's meet this episode's guest. Hello and welcome. It's Dr. Haidar Al-Hakim here, and it's the Surgical Spirit podcast, and I have a great guest today, Dr. Sami Timimi. How are you, sir?
I'm good, thank you, and thank you for inviting me for us to have a chat.
Absolutely. I think, conversations are really important, and really for me, I find conversations a great godsend, really, because it sort of allows us to get out of our own kind of minds and sort of framework and sort of step into other people's lives and sort of frameworks. Did you enjoy conversations when you were younger, or was conversations sort of a big part in your upbringing?
Well, just as you were saying that, I was thinking actually over the years, I think I've learned a lot more from the conversations I've had with people than I've learned from the various books that I've read, courses that I've been on. And I guess those conversations span a range of people, from conversations with other professionals around the things that I'm interested in, with my friends who are doctors in other branches of medicine, but also the conversations from growing up. One of the things that I think looking back at some of the influences that were involved in our growing up helps us understand quite a lot. Nothing's total, but it helps us understand quite a lot about what we became interested in or what we might have struggled with. One of the things about, because like you, I come from Iraq, but I think I was a bit older when we left under difficult circumstances with the deteriorating political situation. So I was 14 when I left Iraq. But one of the formative things I think that was around was that my father and my mother's English and my father's Iraqi, and my mum did a great job of becoming part of the extended family, and she became one of the matriarchs, if you can think of it in that way, in the extended family. But there was lots of different characters. So I think because we were mixing from a very young age with extended family, with cousins, with uncles and aunts, and you kind of begun to learn a little bit about the variety and of the ways people act and interact. So you kind of develop that intuitive sense of how to be different with different people because they react in different ways. And I often think about that, thinking about my own children growing up in this country and what a much more limited opportunities there were for that sort of diverse socialization. So that's one thing I think about. And the other thing I think about is we were a bit of an unusual family because even though there was a lot of very religious people in my family, so in my uncle's family who we were closest to, my extended family, they were very religious. A lot of my cousins were very religious. But my father had turned his back on all of that and was a sort of committed Marxist. And one of his brothers was sort of writing also for the Communist Party paper in Iraq, which was legal at the time. And for him, religion was something that acted as a kind of sedative to the population and stopped them from thinking and stopped them from challenging the status quo. And so I in my adolescence, I do remember a strange to and fro where I was talking to my cousins who were very deeply, devoutly religious, and listening to them, and then going back to my father and arguing, how can you say that God doesn't exist when this, this, and this, and this? And then listening to my father, and then going back to my cousins and saying, well, how can you say God exists and is all around us because of this, this, and this? And it was an interesting schooling in a way in seeing how sometimes quite contrary frameworks for understanding the world around us can make complete sense to different people, but they can't both be true. And so I think I've had this, as I went through my professional training as a psychiatrist, I kept getting very attracted to different models of understanding the mind. But it wasn't long before I started seeing the holes and started asking questions. And so I think it sensitized me to being very skeptical and suspicious of truth claims.
Yeah. And where was your mother sort of in all this kind of toing and froing and I mean, you were kind of essentially not really conflict resolution, but you were trying to bring people together, maybe by going between the camps.
I mean, that's quite a generous interpretation. I quite like that.
I'm a generous guy. You'll find out very quickly.
I think at the time I was, it's that time in life where you're struggling to you're starting to ask these bigger, more abstract questions. I mean, I was somebody who was maybe thinking about things from quite a young age.
Yeah. I mean, I was a rebel when I grew up. I was a rebel because I grew up in a very religious environment, and yet I was exposed to the Western world because I came here at the age of 4.
Yeah.
So I was always pointing at the holes in all the arguments. I never committed to any sort of position myself because I found that I wasn't convinced by anything really, but I understood what the arguments were. But then there were so many holes, and when you point the holes, they don't like you too much. Being a critical person, is not a great place to be in. I guess when I was younger, it was more difficult to do, but because your body was smaller, they can abuse you much more sort of easier. But as I grew up, you tend to defend yourself a bit better. So my power kind of battery got bigger and I was able to defend myself. But I was never really committed to anything. And which is a bit lonely as well.
Familiar. That sounds familiar, yeah.
Which is lonely as well, because you're kind of, you're not part of any kind of tribe, really. But then you go to that tribe because it's comfortable. And you get all the nice cookies and all the nice sweets and so on. And but then you get uneasy there as well, because that's not you.
Yeah, that's an interesting way of looking at it. And it kind of rings true, particularly for when I came to the UK as a 14-year-old. Because I think up until then, that sense of belonging wasn't even a question. It's not even something that had come into my mind. It was just a given. So at those naive ages, I didn't feel insecure at questioning these things. I was just trying to figure stuff out and having lots of interesting conversations in the process. When I came to the UK, and this may be another thing that sensitized me to how living your life involves kind of unwritten rules about how you're meant to conduct yourself according to to your context. And of course, you're not aware of it until you move from one context where the unwritten rules are very different to another one. So as a 14-year-old in Iraq, we'd already sort of approached the ages where the genders were separated, where in order to kind of, how best to put it, in order to be a man, you had to show a comradeliness to your fellow other men, and not show interest in women and girls. That was for something later. There was a kind of cultural assumption that you would be respectful to your elders. So the idea, for example, of speaking back to teachers was a bit of, completely foreign one, and that you would be kind to the younger people. These kind of unwritten rules that you're just living your life, so you don't really know that they're unwritten rules until you're exposed to something different. So coming here as a 14-year-old and not showing interest in girls was the opposite of the way you showed yourself to be a man amongst your adolescent peer group. And then, the classrooms were so different. People were talking out loud and answering back to teachers, and teachers were being pally with the kids. And it was it was very
bizarre. Yeah.
It was very disorientating. So that was the time in my life where, and then there's this kind of ongoing low-grade racism that was there. Other kids asking me, how many camels does it take to buy your mother? And did you come here on a flying carpet?
Sorry, I laugh, but
I know
it's
funny. It is kind of, but at the time, the way it makes you feel is it makes you feel like an outsider, like some sort of a figure of amusement, curiosity, and those were my kind of first experiences, really, of not feeling that I have a place or I belong or I'm part of this. Yeah.
And did you think about going back? Did you say, Dad, why the hell are we here? And did you rebel against that sort of decision?
Well, it was a bit more complicated because I came to the UK with my older brother, and he went to stay with relatives, and I went to stay with my grandmother. And the rest of the family, my parents and my younger brother, remained in Iraq, and my parents had basically arranged for us to more or less escape before, because the situation with Iran was deteriorating and the Iraq-Iran war was on the horizon. So I guess that was another kind of quite lonely thing, because I was shipped out of my family, extended family, and immediate family.
Yeah, and it's a big shock, people coming from a place like Iraq, where there's always people coming in and out of the, of the house, all kinds of individuals, and it's a very, very social environment. And then you come here and you barely get a guest in a 3-month period.
You have to make an appointment, to have anybody around. Yeah, exactly.
So it's a big kind of sort of social shift. And that obviously causes a lot of psychological shifts as well, so where it's always outside, and then you sort of find out that actually there's an inside world in here that I haven't actually looked into.
Yeah.
Hey, you're the psychiatrist.
No, you're quite right. No, absolutely. Yeah. So I think that that was another set of experiences that sensitized me that there are very different ways in which people live their lives, not just in terms of how they understand how the world works, but also there's kind of unwritten cultural, social rules.
Yeah. And, culture, is that something that is inherent within us? I mean, not just on a social scale, but is it something that's passed down? Is it sort of within the genes? Is it within our DNA structure, so to speak?
I guess it depends what you mean by culture. But if you take it to a broad definition, which is it's a set of beliefs and practices which a group of people have in common, and which structures their understanding and the way they live. You can look at cultural groupings in all sorts of different ways. So a cultural grouping could be, so all of us simultaneously will belong to several different cultural groups in which you can identify some differences to other ones. So these could be by family, it could be by religion, could be by nationality, could be by ethnicity. Some people even talk about, like, European culture. So you've got a whole region of. So it's just tendencies that different groups have in common. And I would also add to that professional, because our professions teach us a certain way of orientating ourselves in terms of what we believe and how we practice. So we simultaneously belong to lots of different cultural groupings. And one of the things I think to understand about culture in that way, it's surrounding us, and it structures the stories we tell about ourselves, our life, each other, what's meaningful to us, what our values are. But culture, in that sense, is a living, breathing, dynamic thing. It's never static. And when and problems start to happen, I think, firstly, when you don't acknowledge that we are cultural beings, that we have absorbed different ideas and beliefs, and that these have an influence on us. But also when you do the opposite, which is you start to think of culture as a concrete thing. That's when stereotyping starts to happen, and you start to say, oh, African people are like this, or Iraqi people are like this. Of course, some might be, but Iraqi culture has been influenced by lots of different things. It's not a static phenomena. So culture is all around us. It's a part of us. We need to think about it in terms of, but for any individual, they belong to lots of different cultural groupings, which have had different influences on them. And there's no shortcut to understanding what is meaningful to that individual. Otherwise, you just fall into stereotypes.
Yeah, I mean, culture has always existed and will continue to exist. It's a bit like I'm thinking about the weather. There's the weather here in the UK is always changing. Sort of never stops changing, and yet people kind of do what they put in so much effort in order to kind of understand or predict or whatever about the weather, but it's just not possible. Sometimes you do get wet, and sometimes you do get hot, and sometimes you're not worrying or prepared for a particular kind of weather. And culture in a way is we make all kinds of assumptions about culture.
Yeah.
And
have you come across the weather analogy with emotions and mental health problems?
No.
So the weather analogy, it's one of my favorite analogies. I use it a lot in clinical practice. The weather analogy goes something like this. Life on this planet wouldn't exist without the sun. So the sun is kind of the life force. It's the thing that is the provider of the vital ingredients to make life possible. And as long as there is a sun around, there is life on Earth. And whether we see the sun or feel the sun, we know it's there. So the sun is a bit like the life force. And then we have weather systems on the planet. Now, weather systems, by their very nature, are dynamic. They are constantly moving. They are constantly changing, because there are so many different forces at play that are influencing what happens to weather systems. So they're never static, and but the one thing that you can predict about all weather is that it will be temporary. So the analogy goes that our emotional lives are very much like the weather systems. From the minute our heart starts beating till the minute we take our last breath, we have that life force, which is like the sun. Whether we feel it, whether we're aware of it, when we're asleep, it's still going on. So, there is a life force, however bad or good or whatever we feel, it's there, it's going on. And our emotions are influenced by so many different interacting things that our emotion states are always dynamic. From memories, from associations, whether you're conscious of them to unconscious of them, to what happened a few minutes ago, to the weather itself, to, maybe a phone call, you get a bad phone call or you get a good phone call, to what's happening at your work, to what's happening in your relationships. Our emotions are like the weather. They're influenced by many forces that we often aren't aware of. Often we can't control them directly, and they manifest in us in that dynamic way. And just like the weather, all emotion states are temporary. You can't expect to be happy the whole time, just like you can't expect sunny days to continue forever. But by the same token, even the most miserable time is not going to last forever. If you are open to it, it will change. If you are aware of it, it will change. And so the analogy in kind of the weather, if you want to take the analogy even further, when you get caught up with an idea that your emotion state is never going to change and is going to be there forever, and there's it's a bit like you're hit by a terrible storm, and that storm goes on and comes back, in a few days' time, and it's stormy again. And it was so unpleasant that you no longer trust it when the sun starts coming out, because you're aware that sooner or later there's going to be another storm. So you can't even enjoy the fact that it's a nice sunny day. And sometimes when we get bogged down in those awful states of mental distress, it's a bit like coming to believe that the sun can't shine again. It's a bit like forgetting the temporary nature of all emotional states. That's the weather analogy.
Yeah. And one can think about putting him or herself close to the equator, or if you're in the middle of the Antarctic area and you don't like the cold, you can move yourself towards hotter climates. So there is a form of agency as well that one has. We may not predict or control the weather, but we can put ourselves in situations where it may be a bit easier for us to feel better. this thing about control is I think is important anyway.
I've actually changed my mind about agency and control.
Really?
Yeah. So one of the things I've kind of become aware of, and
could you give us like the backstory of sort of what you mean by that? That you change your mind around agency and control. So where were you before, and where are you now?
Yeah. So I mean, this was part of the reason I put a lot. My most recent book, Insane Medicine, is kind of the point that I've reached to now, where even though I have been skeptical of most therapeutic systems as a totality, but I have been using a lot from different therapeutic systems, and I've generally been drawn towards psychodynamic and systemic theoretical constructs. But I, for a long time, believed that the thing that was most important in producing therapeutic change was some degree of helping people to develop agency and a belief that they can change things. And one of the things I became aware of, because I'd long become aware of the evidence on outcomes, but if you look at population level, there seems to be a correlation, and of course I know correlation is not causation, but there seems to be a correlation between the amount of therapeutic input and also the amount of psychotropic drug prescribing and poorer outcomes. It seems that the more we develop mental health services, it seems to be the more we've got people who are on psychiatric drugs, who are in various types of therapy, who are claiming disability living allowance for having a psychiatric problem. We've got a increase in the number of people who are on long-term treatments and classified as having, chronic mental illness. And anybody who's worked in the mental health service for long enough can see that we seem to be good at creating long-term patients, particularly if we start adding medication into the mix. Not so much if we can resist going down the route of medication. One of the things that started to occur to me clinically with as a consultant, I'm a child and adolescent psychiatrist, and I'm a consultant, and we have a catchment area. So as a consultant to the team that I work with, I naturally tend to see the people who are stuck and who've maybe had a fair amount of input from the service over a period of time. And as the main doctor, most of those, well, it's a mixture. Some come to me having got prescriptions from the GP or from another area or a private doctor, but a good proportion come to me from other members of the team, and that it's not that they've been exposed to psychiatric medication and all that brings, but what they have been exposed to is a story. And this is through the well-meaning and well-intentioned and often very skillful therapeutic input from psychologists or therapists. But the story they come with me to me with is that they have a mental disorder, or they have trauma, or that they have the one that has become very popular these days is emotional dysregulation. Did you come across that one?
Mm.
They're emotionally dysregulated. And they've had therapeutic input. And sometimes they've seen 2 or 3 different people. And so by the time they come to see me, they come with a story that there's something really wrong with them, because they've been trying these different things. They've had like cognitive behavioral therapy, or their parents have been, being given advice. So by the time they come to me, they have a story that there's something really wrong with them, and that somehow they're a failure in being able to change the situation. And so usually they're coming thinking that I might prescribe medication, so that to me is often a sign that they've got to a point where they are feeling desperate to have a more magical solution, because they have a sense that they cannot have agency over this problem. And it was a series of things that happened that started me to think a little bit differently about this group of stuck people. They included things like the ways of working with people who hear voices. So the Hearing Voices movement have tried to depathologize the experience of hearing voices. So whereas a more medical or symptom-based therapeutic approach involves the idea that the hearing voices is a sign of a disorder, disease, something wrong with you, and that the approach of a treatment is to try and suppress these. The Hearing Voices movement said, no, these are legitimate experiences. They likely come out of your unconscious. They're to do with experiences you've had, and it's a bit like different parts of you. Instead of recognizing this as internal thinking, it's coming out as a perceptual experience. So these are kind of, and so a lot of the therapeutic work doesn't involve trying to suppress the voices. It doesn't even involve trying to control the voices. It involves changing your relationship to the voices, so that you don't see them as something that to be scared of. You see them as something to be understood. What is it that they're trying to tell you? What parts of you are being represented? Where did they come from? How might you have a conversation with your voices? And so there were a number of things that one of the other things that actually sensitized me to this comes from our cultural background, which is the idea of fate. Abid Allah. It's in Allah's hands.
That it's written in
we have a predestiny.
Yeah.
And that we might not understand what that predestiny is, but it's not for us to understand. But we can know that there is a meaning, even if we don't know what that meaning is, to what happens to us. Now, I'm not particularly religious, but when you grow up with certain ideas, you don't realize how much they have become a part of you until you have experiences that bring them to the fore. So one of the things that I've found has happened in difficult times of my life is I've had this implicit, almost intuitive feeling that I have to trust that this is what needs to happen. I just have to put my trust that fate will find a way through this. And then another experience that also helped me shift was to do with insomnia. So insomnia is a common thing, and I've, for various reasons, I've had periods where I've had some pretty bad insomnia. And what I realized is that once you've usually insomnia comes because you've got things on your mind, things you can't, your mind just can't stop thinking. But at some point, once you've experienced insomnia enough, the experience of insomnia becomes the thing that keeps you awake. So you start worrying about how much sleep you're going to get in any one night. And, you've got to go to work tomorrow. How are you going to be able to function? And you start clock watching. Oh my God, it's 3 o'clock in the morning. I'm going to have another night like last night, et cetera, et cetera. Yeah.
So the problem becomes a problem.
The problem becomes a problem. And it gets worse because then I started to try and do something about it. I downloaded some apps, and for a couple of nights they worked great. I thought, okay, I've cracked it. And then, of course, after a few nights, it stopped working. So now I think, what do I try next? I tried a different time of going to sleep, different routines. So the size of the problem starts getting bigger and bigger. The more I try and take control of it, if you see what I mean. And then one day there was just a passing comment from my wife. And it's one of those funny moments where something clicks. And her comment was, you don't have to make a lot of fuss about your sleep. That was her comment. So, and I still have it in my mind. I remember going into the bathroom, and I thought to myself, she's absolutely right. Why am I making such a fuss about something that is so ordinary, that most people experience? And when insomnia sort of slipped away from being a problem that I had to solve and back into the brackets of an ordinary experience, an experience that is just going to happen, in an odd way, it released me from feeling I needed to take control of it.
Something that's understandable.
It puts it back into the bracket of ordinary and or understandable, rather than a problem that needs a solution, if you follow me. So those sorts of ideas, the idea of changing your relationship to the problem that I got from the voice hearing movement, the idea of fate, that things happen, and sometimes they happen. We don't know why they happen, but we have to accept that this is. And the idea of, if I define something as a problem that needs a solution and that solution refuses to show itself, this becomes the reinforcing. This is where the problem becomes a problem.
And this goes against this goes against particularly when we're trained as medics, where everything has to have an answer, everything has to have a reason, and everything has to have a solution, and also a very time framed solution as well at the same time. Exactly. Time restricted, or there's always that sort of big stamp of within a week, within
what are you
10
going
days.
To do? Yes. Yeah.
Impression, plan, and then it has to be.
And actually, our bureaucracies are organized that way. So we're meant to have a particular format in which we are meant to carry out our assessments, and at the end there has to be differential diagnosis and your action plan, and it bullets on what you're. And so coming back to that group of patients who I see as the consultant, those group who seem to have had lots of therapy and now come with a story that there's something deeply wrong with me, and now they're looking to medication, which is a very disempowering way of helping someone, because it gives them the message that they don't have the knowledge, skills, or ideas to be able to find a way out. And so it sensitizes them, it hypnotizes them to an idea that if they get better this time with that, their future episodes of distress are not going to improve without them coming back to this. So what I started finding out is that, so this is now anecdotal rather than research, but it does fit in with a lot of what the research says. The way I now work with that stuck group of patients as far as possible is to try and help them change their relationship to their distress. This is particularly common with groups who are experiencing depression and anxiety. Try and bring it back into the sphere of this is ordinary and or understandable, even if we don't know the reasons why. These are common experiences. These are human experiences. And suggest to them, so this is where the kind of ideas from hypnosis come in, suggest to them that now that we're having these conversations, that their unconscious will be sensitized to reformulating and reframing their experiences away from an experience that needs a solution towards what they're doing already, which is they're learning to live their lives despite knowing that they're going to have more bad days. And making the suggestion to them that their unconscious will work on this. And the thing I can't predict is how, when, and in what form the penny will start to drop. And when it does start to drop, what they will notice is not the absence of the distress, but actually that they are more able to enjoy or even just notice the better times. Because what happens when you're very preoccupied with an idea of distress needing to be got rid of is, even when you have a nice time, like go out with your friends and have a laugh, at the back of your mind, it feels like there's always a shadow there waiting, because you can't trust that this is going to go on. You can't trust that this is something that you can enjoy, because you know sooner or later you're just going to crash. So that's that kind of, so in a way, I'm saying you don't need to worry about agency. You don't need to worry about control. We need a better story to help you through this.
And you know, the big barrier is that they are bombarded by this sort of society story that, you know, you've got to be thriving and happy and you know, constantly striving for success.
Yes.
And always doing something that brings you closer to you know, I don't know, nirvana, whatever the ultimate destination is.
There's a sociologist, and I've forgotten her name, Wolfenstein or something, who wrote back in the 60s that we were developing a fun morality in the West, in which if you were not having fun, it was a sign that there was something wrong with you. And I think, you know, you were showing your phone earlier. I think, you know, the availability of social media really amplifies that sense of being on show all the time. And that insecurity about whether you are achieving and functioning in the way that you should be. And what gets mixed in with that story, that you should be having fun, and if you're not, there's something wrong with you, as well as you should be achieving, and all of these sorts of things which make up what I call the compare and compete culture, is this widespread anti-stigma mental health education campaigns that are going on, which is sensitizing people, particularly young people, to the idea that mental health pandemics and crises are all around us, and that you need to be able to identify that and intervene early.
I mean, are they setting us up for failure, or are they setting us up for mental distress or increased mental distress by doing these things?
Well, I think that makes things worse, because I think what it does is it causes us to be suspicious of our emotional states, particularly our intense emotional states. So we start to monitor ourselves for signs, and we start to monitor our children and our loved ones for signs that they are experiencing a mental disorder. And when we become suspicious of our emotional lives in that way, we become very open, vulnerable, whatever word you want to use.
Hypervigilant.
We become hypervigilant, to this idea that there's something wrong, and to wanting the various products that are now on offer very widely in our culture, which are being sold with the idea, what I call the Mcdonaldization of mental health, with the idea that these products will help you deal with these internal problems that you have. I mean, most notably, the pharmaceutical industry have been great, because if you can medicalize children's behavior and feelings of depression, anxiety, and self-doubt in adults, these are huge markets.
Yeah.
But it's also helped the expansion, or what I call the industrialization of therapy. So forms of therapy that are being sold as these kind of, 10 sessions of CBT, that are kind of branded therapies.
Yeah.
But also then courses and self-help books and institutions. There's a whole industry that's developed around this idea, and it's a big industry.
Yeah. And then you can put in procedures and protocols and sort of time frames in order to put the cattle through the system, so to speak, and then give them a nice badge at the end once they've done everything, and then they're left just as probably even more empty. And they've banned heroin and coke and sort of all these things, but really what they should ban is, or at least put a levy on these dopamine and serotonin inducing devices, because if you want to hit, you just go on your favorite app.
And you know what, the conversation we started with about having conversations, about learning from people around you. The thing about this way of understanding and interpreting mental distress is it's sending us into an idea that it's something that happens between the ears. And so the solutions is doing something in here. Whereas in an odd way, it reinforces the loneliness that this culture, I think, promotes with this compare and compete philosophy. So it's not that people aren't getting distressed, but in some way, what's happening with COVID is a really good illustration of that. We've had a lot of publicity on this idea that we're being hit by a mental health pandemic. And most people understand that the mental health pandemic is related to the disruption of our social lives, of our financial security. So it's a disruption of our social and material well-being. But then the corresponding message that goes along and my Royal College, the Royal College of Psychiatrists, are as guilty as anywhere else of propagating this, is therefore we need to boost up funding for mental health services. People need more access to treatments.
But that's understandable on both sides, understandable why people have mental distress. The same token, there are some very easy, simple things that you can do to counteract it, which is much cheaper than increasing funding to certain Royal Colleges.
Yes.
But at the same token, it's understandable from the Royal College to be able to talk about these messages as well, because it is very lucrative, as you said.
Well, exactly. It becomes it becomes an illustration of how both sides of those stories, both sides of those stories are still perpetuating an idea that sees mental health as something that happens within people rather than in the social and material disruptions. And I'm not saying that these should be viewed as binary opposites. But the things that is going to make the most difference to this type of what we're calling a mental health pandemic is going to be the amount we can connect with each other, the availability of job security, the ability to see your friends again, to do things together, these to be connected with your family and so on. These are the things that are going to make the biggest difference to that sort of.
Absolutely. I mean, the thing that really pissed me off and sort of, excuse my language, got on my tits when the pandemic started was using the word social distancing. And I said, don't use the word social distancing. It's physical distancing.
Exactly. Yeah.
It's physical distancing. That's a really
good point.
Because psychologically, when you say let's socially distance, look, I'm Iraqi and we love conspiracy theories. The first thing we do when we're young children is that we talk about how bad the government is. I mean, I was probably about 6 or 7 at the time. All we talk about is how corrupt the government is, how they're stealing all the money, and there's nothing left for the Iraqi people. So, we kind of swim in conspiracy theories from our mother's breast, probably. It's a very Freudian concept, but I mean, but why do you engineer a word which will cause some psychological distress? Now, this is a physical phenomenon. The virus is a physical phenomenon, apparently, which causes physical symptoms. So let's keep it physical rather than delving into the realms of the psychological, which is, as you said, very powerful. The realms of the metaphysical is because you're talking about ideas and stories and ideologies. And I think once we get into the kind of extremes of ideology, that's when people die. In our country, it's because of ideology that people blow each other up, and it's sort of very, very powerful. And I think, if we keep it physical, then things become, easier to understand. But anyway, that's my gripe about. And now they're talking about, instead of physical PPE, they're talking about psychological PPE, and, that's another kind of interesting story that, doctors are sort of really burnt out and can't cope. And I mean, it's not a great story. Okay. It happens to a certain number of individuals, but what you're saying is that actually doctors don't know how to take care of themselves, and they need someone to hold their hand psychologically. I think to myself, well, if I've had 3 days worth of work, I constantly work for 3 days, I'm going to take a break. I'm a human being. I know when I'm about to crack.
Yeah, I think we've kind of moved a cultural. If you wanted to get into a broader discussion of the politics of all of this, one of the things that I think has happened is that as we prostrated ourselves at the feet of market forces, and through our culture open to the idea that we should allow the markets to solve our problems, we shifted our culture away from, again, these are not dichotomies, these are tendencies, away from an idea that change comes about through solidarity, towards the idea that we are each individuals who have to look out for our own interests, and people around us are potential rivals to us for whatever resources there is. So this kind of individualizations. So at some level, the whole culture of psychiatric disorders, of psychotropic medication, and even of psychotherapy or industrialized psychotherapy is replacing solidarity, unions, organized social activism with the idea that when things go wrong, it's because there's something wrong in you, and that it's you who need to sort out your own head.
Yeah.
So these days, I kind of, I've come to the conclusion that what we call psychiatric diagnoses are actually not diagnoses, because in medicine, in nature, we classify everything, and different systems of classification have different principles. The diagnostic system of classification is classification by cause, or at least proximal cause. I mean, we don't fully understand causes of most things. So we understand that when we go to a doctor with some chest pain, they're trying to understand what the cause of that chest pain, and we might feel relieved when he says, oh, the cause of it is an acid reflux, not a heart attack, So we understand that what doctors do when they're doing diagnosis is they're trying to understand the cause, and that their treatments will be related to the cause. Now, in psychiatry, we know nothing about the cause, literally nothing about the cause. So what we call diagnoses are not cause-based, they're descriptive. So when we say that you have depression, we're just describing a set of experiences that the person is talking about. And saying that my low mood is caused by depression is a bit like saying the pain in my head is caused by a headache. A description can't cause itself. And in actual fact, what I think has happened is that psychiatric diagnoses, the reason they've taken off in such big numbers is because they're actually more like brands. They're more like market brands. And some brands have a lot of potential to make a lot of money from. And this kind of fits in to another aspect of the marketization of everything, is that our individual experiences are now potentials to make various types of profit for all sorts of industries.
And what's been the reaction to you saying these things and writing about these things in your books? Because you've written so many books on this topic that psychiatric diagnoses are really shorthand descriptors of experiences.
That sort of thing tends to get kind of polarized responses. So there are a good many critical psychiatrists and critical psychologists and service user movements. There is quite a volume of people who very much understand what it is that I'm saying. And I think then there are the mainstream institutions that are threatened by this idea. But I think the best way to deal with that for those institutions in power is to sort of nod politely but ignore it. And so most of my experience hasn't been a kind of attempt to rubbish it. It's been more just, we don't talk about these things sort of thing. Yeah.
I mean, do you see real change within institutions happening? Do you think that's going to happen in the future, or are we going to experience, more industrialization of mental distress and experiences?
That's one of those questions that's really hard to predict.
Time will tell.
Really hard to answer, because there does seem to be a lot of people who work in that field who understand this and can see that the systems we've created are, however well intentioned they are, may well be doing more harm than helping the populations that we're trying to serve. But then up against them are the powerful institutions, the places that have money and government ear. So
is there a younger generation? I think
there might be a younger generation who are more, because we've had promises of breakthroughs for several decades now, and the cupboard is as empty as it was. I remember a fellow trainee when I was a trainee in psychiatry, and coming towards the end of my training, and I was beginning to be skeptical about where we were going. And we had a bet together that she said within 25 years, we'll have a test, a physical test for schizophrenia. And I said, I don't think so. So we shook hands on that. Unfortunately, I've lost contact with her because she owes me a tenner. But we at the time I was training, it was like decade of the brain, and neuroscience was really taking off, and then the human genome was transcribed, and so all this molecular genetic research, a huge volume of it and it's all drawing a blank. So people are starting to ask some big questions about why are we not getting anywhere with this. And the thing that keeps me hopeful is that you don't know when or how the critical mass will be achieved. The revolution in Cuba started with a few people going over on a boat to Cuba. On the other hand, did anybody see the fall of the whole of the Eastern Bloc and how quickly it happened? Apparently, even MI5 didn't realize that the Eastern Bloc was crumbling and about to disappear. So we don't know when that critical mass will happen and how it will emerge.
I mean, it's the same with COVID-19. Who would have thought that COVID-19 would have, decimated so many countries and economies and people, and the way it's sort of accelerated into something that's become a meme now. It's become part of human history. And I think maybe that the East might have a say in this.
I think that might.
In that Western psychological history and psychiatry history is not really making inroads into the psychological status in terms of relieving psychological distress, and the East are sort of with all the wars and with all the famines and with all the difficulties of sort of living in modern life. So maybe there's a role for us to sort of accept that maybe it's not working here. Because my family just recently came back from Iraq, and they had a fun time, and then they came here and it's like empty house, smiling less and
you see, I mean, it's an interesting point. It's one of the things that I've wondered about. In many ways, psychologically, Western Enlightenment culture is a very young culture.
Mm, mm.
If you wanted to be a bit interpretive about it, it's quite an infantile culture.
Yeah, yeah.
So it's based on an idea that we can have whatever we want, and that, you know, that us as individuals are somehow better than others. So it has a lot of those kind of ingrained ideas of power and superiority, quite infantile ideas of omnipotence.
Yeah.
Eastern cultures have a much longer history of engaging with the nature of human experiences. I know that's a kind of a bit of a simplified argument, but you do get the sense that Eastern cultures maybe have a little bit more wisdom to offer in terms of how to deal with the nature of human experience, because in a lot of Eastern cultures, the idea of suffering is a prerequisite to personal growth, whereas for us, we've created a way of thinking about suffering where it is something that we should be able to eliminate, we should be able to get rid of. So we see suffering as meaningless torture rather than something that might have meaning, something that might contribute to growth, to a deeper understanding.
Yeah, and you know, this is where media and art and film and literature can play a big role. You know, the importance of suffering. The other thing that came to mind is that Western philosophy is younger. It's more logically sophisticated, but it's sort of stayed at the logical level, you know, at the kind of rational level, and is less applicable into life. Whereas the Eastern is more about application into life. And I think if we can get young philosophers to actually translate Western philosophy into actual application in life, you know, that would be an interesting field for them to get involved in psychological therapies and psychiatry, and sort of try and marry the two together. I think that would be an interesting development.
That would be, wouldn't it? Yeah.
You know, rather than making it just an exclusive, you know, kind of a medical modality or specialty, actually to bring in Western modern philosophy and, you know, do it the Eastern way, which is, you know, how can we mix philosophy and religion and modern living? Because, you know, in Iraq, people died left, right, and center. People are getting blown up and sort of what have you, and very, very distressing situations. You know, recently lost our brother-in-law, recently lost an uncle, really young people in very distressing situations. And yet philosophically, you know, or ideologically or theologically or metaphysically, they've found a way of getting through these really major distresses. And here, I mean, you know, I'm not knocking anyone here, but, you know, here you become redundant and you know, it's sort of the end of the world. So, you know, just an interesting observation. The thing that I'm kind of a bit not happy about is that people are trying to use Western ways, Western psychological therapies, and are applying it to the East.
I know.
And I'm thinking, no, what the fuck are you doing? Yeah. You're going to mess these people up even more. I don't know. I mean, that's my view. I may be totally wrong.
No, you're absolutely right. The global mental health movement is very typical of a colonial style operation, with the idea that we understand and know what the best way to approach these problems of human distress and mental suffering, and that it's our job to go and help all these poor people around the world be educated about properly understanding what a mental illness is, what a mental disorder is, and get treatments out there. And a lot of that involves, of course, an expanding role for the drug industry. And it's something that really should be resisted. It's a legacy of colonialism. It's the same sort of mentality that led the missionaries to go out and civilize the rest of the world, to understand that, the Catholic or Protestant God was the only God, and they should get rid of their superstitions.
That's a worry. I mean, that's something that I'm a bit. I mean, let's say I've got a certain level of education. I mean, is it for us to tell them, or is it for them to resist? I guess it's both.
Yeah, because they haven't worked in our.
Well, it hasn't worked here. It's getting worse here, and
So why on earth would we want to do that? Unless, of course, there's money to be made.
Yeah, I mean, I guess we're a bit lucky that we've come from both. We've got feet in both lands and sort of both hemispheres, and we can sort of see both sides. And we've had to adapt in both situations. I mean, when I went back to Iraq in 2006, which was a bit weird because an Easterner goes to the West, learns the West, goes back to the East, and yet when I was in the East, I wasn't considered an Easterner. I was considered a Westerner.
Yes, of course. Yeah.
So it was this sort of constant. It was weird. It was a weird experience, and yet I was still comfortable because I knew where I was within myself. But then I lost my inside compass, and then the whole story went. The compass went round and round and round again, and then I've had to find myself again, and it's quite reassuring because it tells us that we're in, as long as we're breathing, we have to constantly find ourselves on a.
But it sounds like that in some way maybe having to do that was quite instructive and meaningful, and you learned something from that.
Oh yeah. Having these conversations are really interesting, and sometimes we don't take something away from it immediately, but having looked back, I mean, I listened to sort of previous podcasts and I think, oh my God, this really makes sense because I experienced this yesterday. I experienced this state of anger or this state of totally losing myself and being totally antisocial. And then listening to a particular podcast about acceptance made such a big difference in the way I can adapt and learn from these situations. So, I mean, we can talk a lot longer, but I like to keep things to an hour, and we've just gone over an hour. If you were to look back to what you've experienced so far, and obviously you're only 35, what would your advice be to that young man who sort of came here to live with his grandmother at the age of 14? What would you what kind of words of wisdom would you tell him if he was to listen to you and you were to help him?
What a nice question. I think it would be a little along the lines of what we were talking about with the weather metaphor.
Yeah.
That to be patient, to know that there is a way through this, and just to get on with your life.
Yeah.
Just see what happens.
Yeah. Life's bigger than just these kind of what I use, mind fucks basically,
I know. Yeah.
There's more to life than these mind fucks.
Yeah. Keep looking outward.
Yeah.
Find a way.
Yeah. I'm going to say that.
This is one of the other things that I think has happened, that the more we've popularized this idea of mass mental health problems, and we've become afraid of our emotions and sensitized to the idea that they are dangerous, is that we've opened up to the notion that human beings are fundamentally vulnerable. Whereas actually my experience is that most people are actually quite resilient. We do find ways through a lot of difficult situations.
We're like weeds, mate. We're like weeds.
Yes, yeah. we keep growing. Yeah.
We keep growing.
So I think that's one of the things that I would advise my younger self to keep in mind. You're actually quite resilient.
Yeah.
You can get through this.
You're an Iraqi weed, and Iraqi weeds are very powerful.
Of course, weed meant something different when I was younger.
Of course. Yeah, they kept you going.
You used to be called a weed if you were perceived to be weak.
Yeah. Good old days. The good old days when it was rough. It was rough and tumble.
It certainly was.
Thank you, Sami. It's been a great pleasure.
Lovely
Thank you so much.
to you. Yeah, thank you for inviting me.